Hi everyone, Gamma here. Welcome back to the third episode of the Cancer Chronicles. Today is going to be centered around the first week of treatment after my diagnosis. So I sort of briefly went into that. I went off on a tangent and ended up sort of talking about what the first week of treatment looked like. So there might be a little bit of overlap between this and the last chronicle, so apologies for that. This is probably going to be another one that goes out quite late. I tend to end up being a lot more productive in the evening, so these videos usually end up getting loaded at some point in the evening, so a lot of people end up enjoying them the next day, or it's mostly because for instance, I streamed today. The current format, I think, is working pretty well, so I'm streaming Wednesdays and Saturdays at the moment. The Wednesdays are 7 p.m. to 9 p.m. I'm thinking about reducing Saturday's one to make it 2 hours as well. I find that with my fatigue that, sort of streaming constantly for about 3 hours just isn't feasible because I crashed sort of within the last hour anyway. I think with streaming, it's not just the content you're making, it's providing the commentary, managing the stream. It's actually quite a taxing activity, so I think I'm probably going to reduce that down to 2 hours just to make it more manageable and make sure that, that entire 2 hours is interesting rather than a more mediocre 3 hours, I suppose. So, yeah, I hope everyone's enjoying stuff on that end and these Chronicle videos are still helpful. I'd appreciate feedback in the comments or people send me DMs on my Instagram. That's always good for helping me figure out what I'm doing right, what I'm doing wrong. Because I don't know whether this format is working for people until they tell me, and some people were saying they enjoyed it so far. It'd be good to get as much feedback on it as possible just to make sure that the right information is in there and that people are finding it useful. So without further ado, really, I guess we just sort of move into the third chronicle. So I started treatment within a week of being diagnosed, and that was because the doctor that I spoke to, the what is it called when you're a specialist? The bone specialist I spoke to was pretty confident in preempting the diagnosis of it being a Ewing sarcoma. So he was pretty confident that was going to be what it was, and he didn't want there to be any further delays in me getting treatment because he was aware of the situation that I explained in my last video, where it was a pretty dire situation in some circumstances to get an official diagnosis, and that's in part due to what a difficult cancer it can be to diagnose sometimes, its rarity, and I sort of discussed as well some of the attitudes that exist around the approach we deal to certain age demographics when it comes to their health, like how we want to reassure them and the chances are that things tend not to be wrong with them, but how sometimes we need to be a bit more cautious just to make sure that we catch things like this earlier. So so he didn't want there to be any delays, and I opted to have a phone call instead of having to go in for a consultation the following week. So that following week was instead when I began my treatment. So that began with going to the cancer centre in London that I received my chemotherapy, and I had several appointments just in preparation for beginning chemo that week. I was meant to start on Wednesday, but I'm pretty sure I ended up starting on the Thursday instead, and that was because there were so many things that needed testing, so many things that needed doing, because they need as comprehensive an understanding of your health as possible before starting chemo so that they can monitor your vitals and they'll understand which things are being affected by chemo, and for that they need that baseline, so they test quite a few things quite rigorously. So I met my oncologist, who I still see frequently to this day because she manages my checkups and she's a lovely lady. All of the nurses and basically everyone who works as part of that team is lovely. I haven't had a bad experience with any of them. I think the NHS as a whole, but the cancer services that we have available in the UK are criminally underappreciated. And I think, with everything going on with COVID at the moment, they are severely overworked as well. So it's an unfortunate situation because they do incredible work to make sure that people like me don't die. So yes, I met the team who'd be responsible for my well-being over the course of doing my chemo. I had my treatment explained to me, the 5 chemotherapies that I'd be receiving in different cycles, so these alternating cycles. So I'd have 3 chemos in one cycle, which took place over only a single day. But I'd have to take some chemo home with me in sort of like this little carry-on pouch, which I'll explain more about in a minute. And 2 other chemos that I'd have to stay in for 5 days to receive a more extended dose of. So quite a hefty amount of treatment to receive. The worst of which was one called doxorubicin, which is a red one, and it's nicknamed, and it's a nickname that's pretty well known throughout oncology, throughout the NHS, throughout the circles that I know of people who receive treatment. It's known as the Red Devil because it makes you feel severely ill. It's really bad for causing side effects like ulcers. It really messes around with any sort of the tissue lining sort of through your throat all the way down to your behind area, I guess is the most appropriate way of putting it. It's really quite harmful to those particular tissues. And I had a lot of problems with mucositis as a result of having to take doxorubicin. So I had all of the associated risks of the different chemos I was taking explained to me before beginning treatment. And they went into not just what I call the big 3, which is what I call it a bunch of things. It's the something 3, some adjective 3. That's usually what I always like. It's like the main 3 symptoms that everyone knows that if you're doing chemo, you're going to end up experiencing. And those were being sick, being tired, and losing your hair. And I understood that I'd end up getting all of those, which I did, but not the being sick, the feeling sick mostly. My anti-sickness medication was really quite effective, so I didn't really have any problems with that. But there were loads of other things that I didn't really understand at the time. I just wanted to get it started so I could get it over with. So you have to sign documents that you acknowledge the risks and you give consent for them to administer this treatment to you. So I signed away. I signed all that documentation, and before I started, I had to have several procedures done, as I mentioned previously. And the first of those required me to have a PICC line fitted. So a PICC line is a very common tool used in treating cancer or certain other conditions. And the way it works is it's a permanent line or a semi-permanent line that's fitted into one of the deeper blood vessels in one of your arms. And the point of that is so that you don't have to be cannulated every time you have chemo or you need blood taken or so on, or you need to be given fluids. It's this permanent line that basically provides constant access for healthcare professionals to, in my case it was 2, but these 2 lines for whatever procedures needed doing. And it ended up, even though it was a nightmare to maintain because it required constant cleaning, it was always getting blocked, it felt awful, I couldn't shower properly, all of these things. It ended up making procedures very, I don't want to say easier, but it made them more expedient, which in a way is better. So I had that fitted. I was numbed. I couldn't feel my arm. At least I couldn't feel pain, but I could feel them rooting around in there. And they caught me occasionally. Like I could occasionally feel like the tiniest bit of pain because they have to go pretty deep in your arm. So that was not fun. So afterwards there were a variety of different tests. I had blood tests, I had a PET scan, which was mainly used, I'm pretty sure, to reaffirm their understanding of my diagnosis and investigate for any metastases. So metastases are secondary tumours that form as a result of cancer spreading. That's when you typically enter what's known as like stage 4 cancer, which is where it's entered like your lymphatic sites located around your body, and it's spread, so you have secondary tumours growing in other locations. And they do that by injecting a radioactive contrast. And the way this contrast works is it's a radioactive sugar. So malignant cells respire at a higher rate. So when you respire, you use up, in this case, you would use up the sugar and oxygen to create energy, energy that you just use to power your body. And cancerous or malignant cells do that at a much higher rate. So when you use this PET scanner to pick up, I guess, rates of decay from the isotope that's been injected into your body, because the rates of respiration are higher in the cancerous cells, you will see higher rates of radioactive decay in the areas where your tumour is growing. And you can use similar patterns to identify whether any metastases exist, which is a really interesting process, and it's quite fascinating, like the way it works. I remember, so I was a physics student at A-level before I started working in my job and then later getting ill. So it was very interesting going from studying how these machines work and understanding the science behind it to being subject to this form of technology. I'm just going to take a drink real quick because I feel like I've, for a change, done a pretty good job of explaining this, so I don't want to lose this tape by sounding really choked up all the way through. So yeah, I had the PET scan done, and fortunately no metastases, and none to date. So there were other things as well. So I think I mentioned blood test. I had a kidney function test, which also involves being injected with a type of contrast. I'm not as familiar with the way these tests work. I'm pretty sure the way it works is you're injected with a dye or a contrast or something else that is measurable in a blood test, and you're given it, and they take several blood samples at set periods of time, at set intervals of, say, I think 2 hours, and then it decreases over time, something along that line. And they measure the, I guess, efficiency of your kidneys by how much of that contrast is left at the different intervals. That's roughly my understanding of how it works. So I had one of those done. I then had to speak to a specialist about fertility, because even though my particular chemotherapy isn't known for impacting fertility, it's still a risk, and at my age it was something they wanted me to organise. So I spoke to their professional who spoke to me about the intricacies of, yeah. So it was a conversation that Shannon had to sit in on, and it was basically talking about, I guess, almost legal custody of sperm samples and egg samples and that sort of thing. So about how like legally it would work if I were to die, which was a very pleasant conversation. I'd rather not go into too much detail, but you have to store a sample at my age when you start treatment, which really isn't a fun process. It's funny to think about, and I occasionally have a joke about it with other people now, but it's really not pleasant at all, especially when you understand the reasons that you have to do it and the sort of potential ramifications to that aspect of your life because of treatment. That weighs quite heavy. Did at the time, it still does, because you don't have your fertility checked until at least 2 years after you have treatment, or if you're trying to conceive a child, which we're not planning to do, not for several years. So not really an issue for me at the moment, but it's still something I think about quite consistently. So I'm just trying to think about what other tests I had, because there were quite a few. I think that was all of them. So I finally began chemo, and it was terrifying. I sat in my chair, and I was looking around at sort of... Excuse me. I really need to stop drinking fizzy stuff while I'm on screen while recording videos, because I always end up like trying to hold down a burp while I'm trying to talk about something really serious, and it really depreciates the value of what I'm trying to say. So yeah, I was pretty scared. I was looking around at all of these people with no hair, and a lot of them looked really down or unwell. Because a lot of people with sarcoma have their treatment there, you see people with pieces missing, and you can't help but think, and I certainly did. You know, is that what's in store for me? Is this what's coming? And it all was. It all was what was coming. So I had to rationalise that. My arm still ached from having the line fitted, and I had to have it cleaned, and that was very painful. It wasn't always, but it was mostly pretty painful. And I had my anti-sickness fed to me intravenously first, and despite what people may tell you about receiving treatment, as long as you get the right combination of anti-sickness, they manage it pretty well. I know some people who still struggle with it, but that's because of people's tolerance to individual anti-sickness medications. But on the whole, it never really was a problem for me, so I'm pretty grateful that it ended up that way. So I had all of those sort of preliminary things. I had, and I started my first round of chemo, and they gave me these two, and it was very disorienting. Like my head went foggy. Like I could feel a level of cognitive impairment pretty rapidly after I started that, and I drifted in and out of consciousness. I had a really weird sensation that apparently a lot of other people get, where their nose started to feel quite numb. I don't understand why. I had it a few times. It's just the strangest thing. And then they say, we're going to get your last one, and they pull out this little bag, and I didn't realise at first I had to carry this chemo home, this last chemo, this Red Devil doxorubicin. I had to take it home. So I, feeling pretty bad and looking quite like a sort of a sickly pale yellow colour, we went home and took the train, because to begin with I still had a level of an immune system. We eventually transitioned to my dad just driving me to the hospital instead each time. But I took the train the first couple of times. You do get some, not malicious, but you get some concerned looks and some confused looks and inquisitive looks. I think it's just people trying to figure out what's going on, or trying to express a form of empathy without coming across as too forward. So that sucked. And that was it really. That began that cycle of going in and receiving these chemos and getting into a pretty regular routine of building up my stamina and well-being, and going in, receiving these chemos, and going home, enduring the side effects, going back and repeating the process really. I think it's probably worth me, I'm going to do a whole separate video about how chemo sessions work, because I'm monitoring the time. This video is getting pretty long. I'm going to do a whole video about how chemo worked when I had to stay in as an outpatient. I know that sounds weird, like quite juxtaposed. In some of my earlier videos I did explain, but I stayed in a hotel that was funded by the NHS next to the treatment centre. We all did. And I received chemo as an outpatient, but was still sort of an inpatient to a degree. So I'll do a whole video explaining how that works, and then I'm going to do a whole video explaining how the side effects work and the workarounds I had for treating them. What I would say, and what I will end this video with, is that if you are in this situation, you've got your first chemo coming up, or you're quite new to it, most patients are pretty willing to share their experience and maybe offer you some advice. On my first session, I met another patient, Lois Parker, who runs her own cancer page, who she's been making content for quite a long time, called Neuro Low, and she's an inspiration. She's the reason that I make this sort of content, and she guided me through the whole thing, and she taught me a lot of things, and she told me to get everything I could from this experience because we deserve it. And I think what she meant by that was to stay strong and still take advantage of opportunities and try and experience everything you can, even when you're in a position where that might be more difficult. which is part of a philosophy I've adopted, and it's something I live by. And what I would say to you is to talk to people and see what you can learn, because your chances are you'll learn something that makes your treatment a bit easier, and you might make a friend. So yeah, I think I'm going to wrap up there. I'll see you all on the stream next Wednesday if I don't have a topic to make a video about, and then there'll be another Chronicle next week. So thank you very much for coming by, and I hope to hear from you all. Failing that, I'll see you all soon. Take care, everyone.